This is Bose Hamill from the Cullen Eye Institute. This video deals with the surgical management of an exposed gortex knot. This patient's undergone previous PKP with human optics iris prosthesis implantation. The gortex suture used to fixate the human optics prosthesis had the knot tied under a scleral flap, but as is typical for these cases, the knot eroded through the flap onto the conjunctival surface. Subsequently, the patients had several other attempts at patching over the knot, but again, the knot has eroded. The best management for this problem is to bury the knot internally into the sclera. The procedure begins with exposure of the knot itself, carefully dissecting away all the conjunctiva and Tenon's tissue from the suture in the knot to be able to mobilize it, and bury it internal to the sclera. Using careful dissection, all the connective tissue is separated and cleared away from the knot and the scleral entrance wounds. A 20-gauge side port blade is used to slightly enlarge the entrance wound at the knot side, and then using a 25-gauge sure grip forceps, the knot is rotated internal to the sclera. Care should be taken that all tension is removed from the suture to allow it to rotate freely. Once the knot is buried internal to the sclera, I've placed a halo patch graft over the area of the suture to try to prevent any further erosion. This is sutured into place with tenovicral suture. Following fixation of the halo patch graft, the conjunctiva is now brought into position and sutured in place with absorbable suture.